Welcome back to our channel, the channel for the latest news and untold stories about Catherine, the Princess of Wales and her royal family. Today we bring you breaking news. Catherine's oncologist reveals the latest developments in her cancer treatment after chemo. Catherine, the Princess of Wales, recently announced to the world that she's having chemotherapy and that she's been officially diagnosed with cancer. However, in the video message that was released on March 22nd, she declined to describe the type of illness that she's experiencing or share any specifics about the treatment she's receiving. But oncologists have suggested that Princess Catherine may begin therapy for her illness in January, and she's currently on her way to full recovery. This may range from 1 month to 12 months for cancer therapy. Make sure you don't miss this oncologist's explanation at the end of the video. Which kind of surgical procedure did Princess Catherine undergo? On January 16th, Princess Catherine had a procedure that was characterized as abdominal removal. However, Kensington Palace did not make the announcement until the next day, when they disclosed that Catherine was feeling better after the procedure that had been scheduled. It was reported at the point that the illness was not considered malignant. However, the authorities were unable to clarify the kind of surgery that had been performed. They only stated that the operation had been successful. When was Princess Catherine's cancer diagnosed? Catherine confirmed that she was currently undergoing the beginning stages of therapy during the recorded statement that took place on Friday. She also stated that tests conducted following the procedure revealed the presence of cancer. She remained silent about the nature of the discovered malignancy and the details of her radiation therapy. Kensington Palace released an announcement revealing that Catherine discovered her cancer after further testing following her operation. Is it abnormal to discover cancer after undergoing surgery? According to Dr. Yuman Fong, an orthopedic surgeon at the Community of Hope Cancer Hospital in Southern California, the discovery of cancer following an operation on a non-cancerous condition is very uncommon, yet it does happen once in around 4% of such procedures. According to Fong, that 4% figure reflects a person who will be transported to the hospital for surgery for what has been determined to be a benign illness. Examples of such procedures include removing a gallbladder or cyst inside the ovaries. When someone's so young, is it odd to realize that they have cancer? There's a low incidence of cancer among young people. However, the incidence of some malignancies among adolescents and young adults is seen as an upward trend in industrialized nations. Princess Catherine is 42 years old. We're extremely saddened when young individuals are diagnosed with cancer. However, it's also true that they're the ones with the disease who overcome the disease the most quickly, stated Fong. Exactly what type of medical care is Catherine receiving? The palace's press release only revealed that she started treatment around the end of February and provided no further details about her illness or treatment. It's our policy to refrain from disclosing any more private medical data, the statement said of the princess, and like us all, we have a constitutional entitlement to the confidentiality of her medical information. When surgery works, chemotherapy is frequently prescribed to assist in the elimination of any tumor cells that may have been left behind and to prevent the cancer from returning. Nowadays, chemotherapy is administered for fewer weeks of time or at a lower dosage than it used to be in the past. This is because therapies have progressed over time. Can you tell me about the negative effects of treatment within chemotherapy? According to Dr. Monica Avila of the Moffitt Cancer Center in Tampa, Florida, chemotherapy may cause a variety of adverse effects, including, but not limited to, fatigue, nausea, tingling in the extremities of the body, and even hair loss in certain cases. On the other hand, there are drugs that may alleviate these negative outcomes. Additionally, according to Avila, cold caps that calm the scalp might forestall the loss of hair. According to the doctor, the amount of time it takes for a patient to fully recover from such symptoms may range anywhere from just a few weeks to a few months. According to her, the sensations of tingling and numbness sometimes take longer to go away. What is the expected duration of Catherine's treatment? The palace announced that her physicians would make the decision. In the press release, it was said that the princess is currently embarking on her rehabilitation pathway. What does the term preventative chemotherapy mean? There were not many specifics about Princess Catherine's treatment that she disclosed. However, she did say that she was having pyrophylactic chemotherapy, as per the recommendation from her medical team. Cancer patients may require surgery to remove the cancer, and then they may require additional therapy to ensure the cancer's eradication and prevent its return. According to the Cleveland Clinic, the type of medication that's commonly referred to as adjuvant chemotherapy targets cancer cells that were not destroyed by the original treatment. Although receiving an adjuvant medication will require you to have treatment for longer periods of time, it will not increase the probability that the cancer is going to return. As you're eliminating the cancer, whether or not it's in the gastrointestinal tract or in the intestines, or even the reproductive organs or the uterus, the cancerous tissue starts to turn off and shut off, creating small nests on the opposite side of the operation. Newman further stated, the chemo that occurs after surgery and then performed usually has the objective of getting rid of those small cells. It's not known for what duration Catherine's going to keep receiving therapy, but it's a good bet that it will last for many months. Therefore, according to Newman, every single treatment for cancer is entirely unique and intricate in terms of the kind of chemotherapy that's administered and the mix of medications that are used. In the process of outlining the potential duration of Catherine's therapies, he said, "I dislike generalizing, but overall, the duration of medication is approximately 6 months. But those are certain forms of cancer that can be treated only for a few months, and then there are certain therapies that might go on for up to a year." With that being said, the duration of some therapies, particularly those that do not include chemotherapy, may range anywhere from 1 to 3 years. Long-term perspective, it's difficult to determine Catherine's prognosis, since we don't know for the certain what type of cancer it is and what therapy she's receiving. Nevertheless, her own comments provided the hint. When we as a species say the rule is preventative measure, the probability of success will be projected to be in the range of between 70 and 75%, meaning that if you're one of 100 people with the exact same cancer detection and you provide them with the same type and treat them after having surgery, we're anticipating that 75% of those receiving treatment will not face with this cancer once more, the expert explained to reporters. In light of the information that the Princess of Wales has disclosed to the public, Newman is of the opinion that the chances are in her favour as well. "I believe that's actually going to end in a good recovery, and ideally, an average lifespan following the outbreak," he said to reporters. Thanks for watching the video. Please let us know your thoughts, and goodbye for the time being.